Hi, I'm Dr. Ohayon and welcome to our instructional videos on how to treat an allergic reaction. Over here I have an epinephrine autoinjector. Many of you know it as an epi-pen, and it's used to help treat a life-threatening allergic response. What I'm hoping to do in the next few minutes is to show you how to use this epinephrine autoinjector, the epi-pen, the correct way. So many of you know there's a blue cap, which is used as a safety, and an orange end, which is where the needle comes out of. In the case of an allergic reaction, what you want to do is make sure that you have these sides coordinated properly. So we usually point the blue to the sky and orange to the thigh. So the first thing we do is actually line it up. So we line up the pen, and with your other hand you take the blue cap off. Now I usually ask my patients to ensure that they actually put the blue cap down somewhere else so their hand doesn't have the cap anymore. And with your other hand, you actually use a two-handed approach over your pen. This way it stabilizes the pen and it doesn't move over your thigh. Then you press down and count to 5. And you listen for the click. 1, 2, 3, 4, 5. As you come out, the needle is covered, so there's no way of stabbing yourself once again. In this way you actually use the pen only once, and you need to make sure that the pen doesn't move anywhere. So let's do that once again. With these trainers you can actually recap, so you can't do this with a real one. Blue to the sky, orange to the thigh. You do not have to jam it into your thigh. I usually ask my patients just to line it up. You line it up first this way you don't make a mistake. Take the cap off, put the cap down. Your second hand, you just wrap around your first hand to stabilize the pen. Push down, listen for the click, and count to 5. 1, 2, 3, 4, 5, and then out. You can massage the area if you wish afterwards. In this way, you've used your epinephrine properly, and after using your epinephrine autoinjector, you call for help. That could be 911, or just make it to a service that can provide emergency medical care at that time. Now, just a small side note about infants and children, where usually I ask the parents, when they administer this to their children's thighs, you take the same pen the same way exactly. The only difference here is blue to the sky, orange to the thigh. You take your other hand and actually support your child's thigh. So once again, blue to the sky, orange to the thigh. Take the cap off, cap down, and with your other hand you support the bottom part of the thigh for the child. You push down, 1, 2, 3, 4, 5, and out. I hope that's given you some information on how to use the epinephrine autoinjector. And just a final note about these EpiPens. Whenever we use these pens, everybody gets nervous. Whether it's the parent, the patient, and the doctors and nurses, or any other healthcare professionals. So it's normal to feel a little bit nervous. But I can tell you that the sooner you use the epinephrine autoinjector, the quicker you get better. And I would always encourage early use to help recover a patient, a child, from an allergic reaction. Thanks for tuning in, and we'll hopefully produce more videos for instruction through our office and our production team.